Hi everyone, today we'll be tackling two high-yield genetic questions. We'll go through each answer choice, explaining why they are correct or incorrect. So let's start with the first question. A 24-hour-old newborn screening test showed increased levels of phenylalanine, phenylpyruvate, and phenylacetate. 1 week later, mass spectrophotometry confirmed elevated phenylalanine levels. What mechanism is associated with the etiology of the most likely diagnosis? A. Defective ion transport. B. Dysfunctional tyrosinase. C. Impaired lipid degradation. D. Increased central nervous system damage. E. Increased melanin synthesis. Now, the correct option here would be D, increased central nervous system damage. The clinical scenario here is highly indicative of phenylketonuria, which is a metabolic disorder caused by a deficiency in the enzyme phenylalanine hydroxylase. As you can see in the pathway provided below, this enzyme is essential for converting phenylalanine to tyrosine. Without it, phenylalanine accumulates. The toxic buildup of phenylalanine and its derivatives disrupts the brain development, leading to intellectual disability, seizures, and microcephaly if untreated. Let's have a look at why the other options are incorrect. Option A, defective ion transport, is incorrect because phenylketonuria is due to a deficiency in phenylalanine hydroxylase and not an impairment in sodium or chloride transport. Option B, dysfunctional tyrosinase. This is incorrect because, as you can see from the pathway provided below, tyrosinase is an enzyme involved in melanin synthesis from tyrosine. A deficiency in tyrosinase leads to albinism and not phenylketonuria. The issue in phenylketonuria occurs before this step at the level of phenylalanine hydroxylase, preventing phenylalanine from being converted to tyrosine. And option C, impaired lipid degradation, is incorrect because phenylketonuria is a disorder of amino acid metabolism and not lipid metabolism. And option E is incorrect, increased melanin synthesis, because in fact, in this case, the opposite occurs. Because phenylalanine cannot be converted to tyrosine, melanin production decreases, often resulting in lighter skin, blonde hair, and blue eyes in affected individuals. Let's have a look at the second question. A 25-year-old man visits the orthopedist for evaluation. His medical history includes easy bruising and frequent joint dislocations, including his shoulder and thumb, during athletic activities. Physical examination reveals joint hypermobility, stretchy skin, and scars that are wide and thin in appearance. What is the most likely diagnosis? A. Ankylosing spondylitis. B. Ehlers-Danlos syndrome. C. Marfan syndrome. D. Osteomalacia. E. Scurvy. The correct option here would be B. Ehlers-Danlos syndrome. Now, the combination of hypermobility, skin hyperextensibility, and fragile wound healing is characteristic of Ehlers-Danlos syndrome, which is an inherited disorder affecting collagen synthesis and cross-linking. Now, collagen is a critical protein for structural integrity, and the main finding here in Ehlers-Danlos syndrome would be joint hypermobility, which leads to frequent dislocations, skin hyperextensibility, which leads to soft, stretchy skin, easy bruising, and fragile blood vessels, which increase the risk of aneurysms and prolonged bleeding, and poor wound healing, which leads to thin, atrophic, cigarette paper-like scars. Let's have a look at why the other options are incorrect. Option A, ankylosing spondylitis, is incorrect because this condition causes stiffness and fusion of the spine and not hypermobility, and it presents with low back pain and morning stiffness. Option C, Marfan syndrome, is incorrect because Marfan syndrome affects the fibrillin 1 and not the collagen directly. Its features include a tall stature, long limbs, lens dislocation, and cardiovascular issues. The patients who have Marfan syndrome, they have lax joints, but they do not have the skin fragility or poor wound healing seen in Ehlers-Danlos syndrome. And option D is incorrect because osteomalacia results from vitamin D deficiency, causing weak, soft bones due to defective mineralization. Patients present with bone pain and fractures, but not hypermobility or skin changes. And option E, scurvy, is incorrect because scurvy is caused by vitamin C deficiency and it leads to defective collagen synthesis. The symptoms include bleeding gums, corkscrew hairs, poor wound healing, and joint hypermobility is not a typical feature seen in scurvy. This marks today's set of questions, and thank you for watching.